Hi friends, this is Dr. KiranDSekhar. I am the Chief Infertility Specialist and IVF Specialist at Kiran Infertility Hospital at Hyderabad. We have our center in Hyderabad, in Chennai and Bangalore and some other places also. Infertility causes and management. Infertility actually has become a very burning topic now for the young couples as well as for couples who are in the middle age and approaching the age of 40. So, not getting a child within 1 year of the married life is called as infertility when the patients or the couple are living together and they are not using any oral contraceptive pills. Then within 1 year of regular intercourse, husband and wife, they should have a child. But if this doesn't happen, then we call it as a primary infertility. The secondary infertility is they have already have 1 or 2 children and then afterwards they are not able to conceive further, that is called as a secondary infertility. Now this primary infertility, the 50% the cause is male, 50% the cause is female, so equally divided between both the partners, and sometimes the fault may lie with both the partners little bit. Now how we actually deal with this infertility is because it's like a social stigma, or the society actually, or the parental pressure or the peer pressure will be there, so that they should actually have a family now. So the first approach that the couple should adopt is to go for a good center with a good reputation, with a good results, and also which is cost effective for them. Then get an appointment fixed, get a counseling session done, talk to the doctor, tell them about your difficulties or your history, if in the past some problems have been there or something like that. So all this will be noted down by the infertility expert there, and then the couple will be asked to go for investigations. In the investigations we can find so many causes for infertility. To tell you in short, it may be a hormonal factor, it may be a tubal factor where the tube is blocked, or it may be an endometrial factor where the implantation is not taking place because of the thin endometrial lining. There are so many other factors in the male partner also, like low sperm count, low motility, low normal forms of the sperms, that is called as a teratozoospermia, where the sperm cells are actually abnormal in shape and they are not able to fertilize the egg. What should be done in such patients is, or such couple is, that they come for ovarian stimulation, that is the female partner is given the stimulation of the ovary, whereby we get multiple eggs instead of 1 or 2 eggs which they produce in the normal cycle. Here we get multiple eggs. So this will help in our pregnancy rate, to enhance our pregnancy rates for the particular couple. So this ovarian stimulation is very simple. Every day the patient comes to the clinic, or every 5 days she comes to the clinic for monitoring, and sometimes they self administer the injections also, which are very easy and they do not have much side effects. 10 to 12 days of stimulation will lead to eggs maturing, and then we may get number of eggs on both the sides. These eggs are then made to further mature by a last injection of HCG, which will trigger the maturation of the oocyte or the egg. Now these eggs are aspirated with an egg aspiration needle 36 hours later under general anesthesia or under local anesthesia, and these eggs will be handed over to the embryologist, who will process them, isolate them, identify them, then incubate them in a particular incubator, and finally the sperms are collected from the husband that day, or frozen sample also can be used, and then a baby is made in the laboratory. Now this baby actually divides the next day or within 18 to 24 hours, and it becomes 2 cells, 2 to 4 cells, 8 cells, like that the multiplication goes on, and lots of cells are formed when it is called on day 6 as the blastocyst. Now this blastocyst is ready to hatch sometimes and then come out of its shell and go and implant in the uterus. So at that stage we take it into a catheter and put it into the uterine cavity of the female and support her pregnancy. If any pregnancy is going to occur, we support it with the hormonal injections and tablets. So this is in short the procedure of in vitro fertilization or intracytoplasmic sperm injection, which may be needed in particular cases. So this is a very good treatment for infertility, where within 1 or 2 cycles actually the pregnancy rates may be good, and then within 3 cycles most of the patients would conceive, except very difficult cases which need further assessment and treatment. Thank you.